So Denyse, we met at the healthcare town hall that I held a couple of weeks ago, and you had some really interesting perspectives and questions that you talked about there. So we wanted to follow up on that.
I've been in healthcare for about 18 years. I started out as a medical biller.
Okay, what are some of the things that people don't know that you know because of your experience in working with insurance companies that are hurting the way that they might be able to get health care?
I can tell you a little story about me. My youngest son has epilepsy. He was diagnosed with when he was 7. He was in the hospital in and out because his seizures weren't controlled. He would have 30 to 40 sometimes a day. It was really, really bad. They got him on some medication that finally stabilized him and stabilized his seizures. I went to a job working for a cardiology group, and their insurance was not the best. But if I read through the policy, and it said if you're getting this insurance and you're already on this medication, then it will be covered.
Right.
Doctor called into the pharmacy, sent the prescription over. I went to pick it up. It's not covered, $250. And I went home, and the next day I got on the phone and I'm calling Blue Cross. So I said, look on page so-and-so, because I had it saved on my computer.
Yeah.
And it says, clearly states that this medication is covered. They called me back and said, you are correct. We're going to cover the medication. We'll send you a check. And he's covered. And I said, okay, that's fine. But I said, what about all the other people
who don't know
who
this
don't
much?
know this
Yeah.
and who didn't have time to research, and they paid out of pocket for this?
Right.
Are you going to refund them? And they were like, well,
What do you think are some of the benefits of if we did change over to a system like Medicare for all?
you don't have to worry about not being covered. You know that you're going to be covered for your basic, for all your doctor visits. Your medication is going to be covered. And if it's not covered, you are told that, and the doctor's office is also aware of what Medicare does and doesn't cover. Whereas with private insurance company, I would have to get on the phone and say, oh, wait, is this covered or is it not covered? With Medicare, I don't have to do that. I can just go online, look, okay, it's covered, you're good to go, and you're out the door.
Right.
With Medicare, it's straightforward.